My name's David Gregson. I'm very sorry not to be able to join you this morning. Share some thoughts on the Be Well programme currently operating in Greater Manchester and shortly to go to a second location elsewhere in the country, to explain to you why I in particular am determined to make a difference to young people's well-being in our country. In general, the Be Well programme has been designed to make the well-being of young people everybody's business, inspired by what young people themselves have said to us about their lives, the key elements that concern them, the barriers that they have to overcome. We're listening to their voices in enormous numbers, inspiring a coalition then to act on the results of those surveys and then ultimately celebrating the improvement of their well-being. So why is it that I'm so determined to develop this programme with partners and colleagues? Well, first of all, by any standards, the well-being of young people in our country is at an incredibly low relative level compared to other countries, whether that's through the UNICEF work, through PISA, through HBSC. There are numerous benchmarks by which we can see that young people are not as satisfied with their lives in our country as they are elsewhere. There's this lack of consistency in the way we look at well-being, the way we think about it. There are estimated to be some 200 different ways of measuring well-being in action in English schools alone at the current time. And of course, we're in an environment where mental health issues are steeply on the rise for young people. NHS digital data confirms that in spades. CAMHS capacity is heavily stretched. And it's time for a broader, more holistic approach. It's good to know that those who look at the Be Well programme do believe that it's an exemplar of the sort of work that could be rolled out across the country. Andy Haldane, the Levelling Up Tsar at the time, described it as an exemplar of what levelling up could and should look like. And we were very pleased when Rachel Sylvester and her team at the Times Education Commission, including annual well-being measurement along the lines of Be Well, was included as one of her 12 recommendations in her recently published report. And I think therefore it's important in its own right, regardless of whether you think that happier children make better students and learn better or whether you don't. It's time that we gave greater weight to two aspects of young people's lives and not just one. Well-being is important in its own right. So in terms of progress across Greater Manchester, we designed the programme nearly 3 years ago, pre-pandemic, and prepared to launch it, which it was launched last September in its first year. Some 93% of secondary schools signed up to participate. Not all of them delivered the survey for very good reasons. But in the end, we heard the voices of nearly 2/3 of young people in years 8 and 10 across some 170 secondary schools in Greater Manchester. The results were published privately to participating schools and then published transparently by neighbourhood, freely available for anyone to see themselves. And this has inspired, this published data has inspired some 10 to 15 actions by some of our 100 or so coalition partners to act on the results. We estimate that over £500,000 worth of programmes has already been brought to bear into Greater Manchester that might not otherwise have taken place. That is just, as you can imagine, a beginning, but it's a great start. We have ambitious plans. We have funding for a further 2 years. And so in the coming year, we're going to be surveying years 9 and 10, and then we'll go back to years 8 and 10 in the final year. The main thing is, though, that we have signed up yet more schools, including schools who vehemently said they would not participate last year. So we anticipate and expect to hear the voices of some 80% of young people across Greater Manchester in the relevant years in the coming couple of years. It's not just hearing their voices, though, as I said before. We've created some programs ourselves, which build on those of our partners. So there is a social prescribing pilot, which has been funded by Children in Need. There's a young researchers program that the University of Manchester has put on. There's a commissioning pot that the young people themselves can deliver upon, which is funded by Big Change. And the Politics Project has brought the views of young people much closer to politicians so that they can act upon them directly. We have, of course, got an active research program fronted up by Anna Freud and the University of Manchester, which has a big program of research now ongoing. But in terms of our longer term objectives, if this is to hold sway across the country, we clearly need to show that it can operate in a second location. So we've identified 3 integrated care system areas in the south of England, which are of a sufficient size and yet sufficiently complex and with a combination of coastal, rural and urban areas in them, that we are going to deliver the Be Well programme, if we can, starting next September. That's September 23. We're already in discussions with those 3 areas. We'll be choosing one of them together in the next few months, certainly we hope by the end of the year. That will require fundraising, of course, but we've already got 10 enthusiastic funders for the work that we do, and we've already received a number of expressions of support to assist us to go into a second area. And then finally, we anticipate recruiting, with that further funding, a small central team. Our ambition is to have consistent well-being measurement in every corner and every community and every school of England by 2030, with a vast coalition of actors acting upon the results and a radically changed narrative surrounding our young people. It's an ambitious plan, but it's sufficiently well embedded now in Greater Manchester that we have every encouragement to think that this could be a seminal change to the way that we think about young people. We look forward to working with all of you and to getting your feedback as the programme develops.